When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
If it's making news, he's talking about it. Elias Makos, CJAD 800.
All right, welcome back to the Elias Makos Show, third hour of the program. A recent report reveals that over 20%, get a load of this, over 20% of Quebec adolescents take medication for ADHD. That's attention deficit hyperactivity disorder. Far more than kids in other Canadian provinces. While 5% of Quebec's population was prescribed such medications in 2023, the rate for boys aged 12 to 17 reached 22.3%. That's compared to 12.1% nationally. Big divide between Quebec and the rest of Canada. Experts attribute this to overdiagnosis, quick evaluations, and a growing reliance on medication to enhance academic performance. Let's talk about this a little more with Dr. Annick Vincent, psychiatrist and author. Dr. Vincent, welcome to the program.
Hello.
Let's, first things first, talk about attention deficit hyperactivity disorder. When I was in school, we were not talking about this. So why don't we start off with what ADHD is?
Well, as you said, ADHD stands for Attention Deficit and Hyperactivity Disorder. So it's what we call a neurobiological disorder. It's a difference in the way your brain is wired, I would say. You have it when you're born. So it's not something that you get or that you will develop eventually. You have it as a kid, and you may or may not outgrown it. If you look at the way our brain is wired, we need to be able to self-modulate, to be able to prioritize whatever information our brain is receiving. It could be your what you hear, what you see, what you think, what you feel. So that kind of chief orchestra, I would say, is having more difficulty to do that prioritization, the ability to say, oh, well, this is important, this is not. So to filtrate everything and coordinate all that is something that is more difficult to do when you have ADHD. So that kind of chief orchestra needs to be more stimulated to get it right. So this is why the medication that we use to treat ADHD are stimulants. So we stimulate the break. ADHD-like symptoms may appear in different situations that are not related to ADHD, or that could increase your ADHD symptoms if you do have ADHD. And it is quite difficult sometimes to make, to be able to do the right diagnosis between, let's say, if you don't sleep well enough, if you are anxious, if you're living with stressful events. All of this can influence the way you're able to modulate your attention and modulate your behavior, modulate your movement. Uh-huh. So it's quite difficult to do the diagnosis good. And why we do have to do a good diagnosis is because the diagnosis doesn't equal medication. A good diagnosis equals that the person will know what they have, know better how to get around the symptoms, install all the strategies that may not be pharmacological to help them deal with the symptoms. And us as professionals, when we do have the right diagnosis, we're better able to apply specific strategies, including psychotherapy, including some kind of psychoeducational intervention, and could be medication also.
So let me just ask you this, because that number of Quebec boys, 12 to 17, reaching 22.3%, it seems unbelievable. If almost a quarter certainly doesn't, right? It is, right?
It is out of norm. Certainly.
So are we just trying to find the easy way out here?
Well, we don't know what's happening. We don't know what's happening, but for sure, when we look at the statistics, it should be, around between 5 to 10%. So when you are double that number, it's either we have way more ADHD people living in Quebec, or we are having difficulty to get the right diagnosis and also to get the right follow-up after you've been diagnosed with whatever. Because if it is a problem if you don't get the right diagnosis. If we overdiagnose something, we will not treat the right thing the right way. But also, if we underdiagnose the right thing, let's say ADHD, it could also have impact for the person who has ADHD. But those statistics are way over the norm.
We're with Dr. Annick Vincent, psychiatrist and author. We're talking about the number of children in Quebec being diagnosed with ADHD and why it seems to be outside of the norm, especially compared to the rest of Canada. What if we're overdiagnosing and we're over-medicating? What would be the results of that? What is the detriment of that?
Well, missing what's beyond the symptoms. Let's say that person is anxious. Let's say that person is having a stressful event. Let's say that person is having sleeping difficulties. We're not treating the right problem underneath the problems. And also, it is important to remember that if you do have ADHD, it is really important that you get multimodal approach that may include medication. And that's also an issue for those who live with ADHD, is to get the whole package, I would say, not just medication.
What could be what could be some of the motivations, the motives that we end up with so many children being diagnosed this way? Like, what are the for the doctors that are handing out these prescriptions? Is it the teachers that are complaining to the parents? What do you think are the motives behind these numbers?
Well, the motives beyond a consultation for ADHD-like symptoms could be you're having difficulty with attention, or it could be also behavior problems. So depending on why, and sometimes people confuse having difficulty at school with having good grades and a learning problem. Maybe they confuse it with the ADHD. So it is a lot of things.
Well, what do you think on the doctor's end, right? Like, you have doctors who are prescribing these medications. It's clear by the numbers they're probably doing it too often. So what is their motivation? Is it because, they're swamped with work and this is an easy solution? Why do you think that's happening?
Medication is never an easy solution, but you may be pressured to get a diagnosis right away. That could be something. It could be also that, to do a good diagnosis, it takes time. It takes time to do it. You have to also evaluate, you get the point of view of the parents, the teachers, the child, and a lot of things may look alike. The other thing is that when you're struggling with, is it really ADHD or is it a learning disorder? To get through that, you need to have a neuropsychological assessment. And this is very difficult to have, and it's mostly not covered by our public system. So that's one thing. The other thing is that all the other aspects that we should do before installing the medication are also not easily available in our public system. So that's a huge, huge problem.
Do we need to have more tolerance for just boys who are, outside the norm, are slightly more rambunctious, maybe causing some disturbances, and some of this is just normal boys, boys will be boys kind of stuff, or not?
Usually when we are at the level of prescribing medications, because there's a real problem out there. So, the norm maybe not that is a problem.
Yeah.
But what's beyond, a behavior problem, what's beyond an attention problem is a huge a huge display. We do have problems with screen time. We do have problems with self-modulation in the general population. Mm-hmm. There's a lot of people out there who are anxious or overwhelmed or overpressed. We push our kids in situations that can be difficult, but we also, as parents, we need to help them develop those tools to be able to better self-modulate. If we don't teach our children to deal with frustration, to deal with waiting, to deal with the general normal emotions, that's a huge issue also.
Dr. Vincent, we have to leave it there. Thank you so much for the discussion. I appreciate it.
Thank you.
That's Dr. Annick Vincent, a psychiatrist and author.